Central Oregon educators will get nearly $1 million in federal funding for mental health resources. Noah Chass joins us with more on how that'll be spent. Noah?
Yeah, Lee, the federal money will be spent on students and teachers to let them know that it's okay to not be okay. The nearly 2-year-long pandemic has only emphasized the mental health struggle that already exists in schools.
The second leading cause of death among 10 to 14-year-olds is suicide, and that's just not acceptable.
Jim Bowen is in his first year as Regional Director of Mental and Behavioral Health with the High Desert Education Service District. He's worked in education for more than 20 years and says the isolation and stress of the pandemic has taken its toll.
That has caused a lot of mental health anxiety and issues that have kind of come to the surface. It's not like it wasn't an issue before, but the pandemic has brought it more to the surface than what it was.
There's a point where we can handle so much and then kind of reach that breaking point, and everyone has a breaking point, right? But now that breaking point, we get to it much more quickly, right? It's harder. We're just living in chronic stress.
Amber McGill is a culture of care coach with the High Desert ESD, providing mental health coaching to staff in all 3 Central Oregon counties. With the High Desert ESD now getting $900,000 of federal funding, McGill thinks they can make systemic change to mental health services and education.
So for us, I think we're able to maybe even move a little bit beyond our little Central Oregon space and be a model for the state is the hope.
The money will be used to hire more and better pay their staff and to continue coaching the existing staff on how trauma affects the brain.
If there are things in the way emotionally that we're dealing with or struggling with, then our mind isn't able to focus on learning. It's not a priority.
The goal is to create a more understanding culture with the adults in education who can pass down the practices they learn to their students.
The more adults understand that and adults are in a good place with their own mental health, the better they are going to be able to serve kids. And again, ask the question of what happened to you rather than what's wrong with you.
They hope these funds will help create a conversation which will help more kids stay safe and succeed.
When kids aren't doing well, then they need support. And it's not because they don't want to, it's because they don't know how.
The federal funds need to be spent by the end of the calendar year, so Bowen and McGill expect a lot of changes to happen, and they hope to reach out to as many people as possible. Lee?